Have you ever wondered what it's like to live with bipolar disorder? This mental health condition is characterized by extreme shifts in mood, from manic highs to depressive lows. It's not a rare phenomenon. Millions across the globe experience these intense mood swings. In fact, bipolar disorder is one of the leading causes of disability worldwide. It's a topic that's relevant and prevalent, touching countless lives directly and indirectly. So let's dive into some commonly asked questions about bipolar disorder. First and foremost, what exactly is bipolar disorder? Bipolar disorder, also known as manic depressive illness, is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out daily tasks. These moods range from periods of incredibly high energy known as mania to severe depression. Now, there are two main types of bipolar disorder, bipolar 1 and bipolar 2. Bipolar 1 is characterized by manic episodes that last at least 7 days, or manic symptoms that are so severe that immediate hospital care is needed. On the other hand, bipolar 2 disorder is defined by a pattern of depressive episodes and hypomanic episodes, but not the full-blown manic episodes that are typical of bipolar. Understanding bipolar disorder in all its complexity is the first step in empathizing with those who live with this condition daily. In essence, bipolar disorder is a mental health condition characterized by extreme mood swings. So what causes bipolar disorder? This question leads us to explore the potential causes and risk factors. It's important to note that the roots of bipolar disorder aren't fully understood yet, but current research indicates a blend of factors. Firstly, genetics play a significant role. If you have a relative with bipolar disorder, your chances of developing it are higher. However, not everyone with a family history of the condition will experience it. Secondly, environmental factors can also contribute. High-stress situations, traumatic experiences, or significant loss may trigger an episode of bipolar disorder in some individuals. Lastly, we can't overlook the role of brain structure and functioning. Research shows that the brains of people with bipolar disorder may differ from those without it. Certain brain features may make an individual more susceptible to the condition. While the exact cause is unknown, a combination of factors can contribute to the development of bipolar disorder. How do doctors diagnose bipolar disorder, you ask? Well, diagnosing bipolar disorder isn't as straightforward as conducting a single test. It involves a comprehensive process that includes various elements. Firstly, doctors conduct a full physical examination and medical evaluation. They do this to rule out other conditions that may be causing or contributing to the patient's symptoms. This could include anything from thyroid conditions to certain types of cancer. Next, psychiatric assessments come into play. Mental health professionals will perform detailed interviews or use specialized questionnaires to gain insights into the patient's thoughts, feelings, and behavior patterns. They are looking for evidence of manic or depressive episodes, both key hallmarks of bipolar disorder. Some professionals may also use the Diagnostic and Statistical Manual of Mental Disorders, commonly known as the DSM-5, as a guide to help identify and classify symptoms. In some, diagnosing bipolar disorder involves a careful examination of symptoms and medical history. It's a thorough process, but a necessary one to ensure a correct diagnosis. How does bipolar disorder impact daily life? It's a question that resonates deeply, isn't it? Imagine being on a roller coaster ride of emotions, but unlike a theme park ride, you can't step off when it becomes too intense. That's the daily reality for those living with bipolar disorder. Relationships often bear the brunt of this emotional turbulence. The unpredictable mood swings can strain personal connections, making it difficult to maintain steady relationships. One moment you're the life of the party, and the next you're retreating into a shell, pushing loved ones away. The disorder can also wreak havoc in the workplace. Concentration and productivity may suffer during depressive episodes, while manic periods could lead to impulsive decisions. It's a constant battle to maintain a balance, often leaving individuals feeling drained and isolated. Finally, the overall quality of life takes a hit. The constant emotional upheaval can be exhausting, leading to a diminished sense of well-being. Bipolar disorder can significantly impact all aspects of a person's life, but with treatment, it's manageable. Is there a cure for bipolar disorder? A question many ask, and the straightforward answer is, unfortunately, no. There is currently no definitive cure for bipolar disorder. However, it's not all doom and gloom. The condition is certainly treatable, and many individuals with bipolar disorder lead fulfilling lives with the right treatment plan. Let's delve into treatment options. Firstly, medication is often used to help stabilize mood swings and manage symptoms. These can include mood stabilizers, antipsychotics, and sometimes antidepressants. Secondly, psychotherapy plays an integral role. Cognitive behavioral therapy, for instance, can help an individual understand their patterns of thought, enabling them to better manage their condition. Family-focused therapy too can be beneficial, especially when it comes to providing support systems. Lastly, lifestyle changes can significantly influence the course of the disorder. Regular exercise, a balanced diet, and sufficient sleep can all contribute to better mental health. While there's no cure for bipolar disorder, treatments can help manage symptoms. It's about finding what works best for each individual. Can people with bipolar disorder lead normal lives? This question often lingers in the minds of those diagnosed with the condition and their loved ones. The answer, thankfully, is a resounding yes. The key lies in appropriate treatment and a strong support system. Consider the story of Jane, a successful lawyer who was diagnosed with bipolar disorder in her early 20s. Faced with a challenging journey, Jane didn't let her diagnosis define her. With regular therapy, medication, and the steadfast support of her friends and family, she has been able to manage her symptoms and lead a fulfilling life. Or take the example of Sam, a talented musician who, despite his diagnosis, has produced chart-topping albums. His success story is a testament to the fact that with the right medical intervention and understanding from society, individuals with bipolar disorder can thrive. In conclusion, with appropriate treatment and support, individuals with bipolar disorder can lead fulfilling lives. What can friends and family do to support someone with bipolar disorder? This question often arises when a loved one is diagnosed. The first step is understanding the disorder itself. Knowledge is power, and in this case, it can help to dispel misconceptions and foster empathy. Encouraging treatment is another crucial way to provide support. This might mean helping them to find a therapist, accompanying them to appointments, or simply reminding them that it's okay to ask for help. Remember, though, it's essential to respect their autonomy throughout this process. Maintaining a stable environment can also be beneficial. Routine, predictability, and calm can provide a comforting backdrop to the highs and lows of bipolar disorder. It doesn't mean walking on eggshells, but rather creating a space where the person feels safe and supported. Each person's experience with bipolar disorder is unique, and support may look different for everyone. However, one thing is clear: support from loved ones can make a significant difference in managing bipolar disorder. Is it possible to prevent bipolar disorder? This is a question that lingers on many minds, particularly those with a family history of the condition. The truth is, as of now, there's no definitive way to prevent bipolar disorder. This is largely because the exact causes remain uncertain, although a mix of genetic, environmental, and physiological factors are believed to contribute. However, this doesn't mean we are entirely powerless. Early detection and intervention play a significant role in managing the disorder. Recognizing the symptoms and seeking help without delay can lead to more effective treatment strategies. This may include medication, psychotherapy, lifestyle changes, or a combination of these. Moreover, ongoing research continues to shed light on the disorder, and this knowledge may eventually lead to preventive measures. Until then, the focus remains on managing the symptoms and improving quality of life for those affected. While there's no surefire way to prevent bipolar disorder, early detection and treatment can help manage its impact. In conclusion, what should we remember about bipolar disorder? Bipolar disorder, a complex and often misunderstood condition, affects numerous individuals worldwide. It's not just a switch of mood from happy to sad, but an intricate dance of emotions that can be as unpredictable as they are intense. We've explored its definition and causes, understanding that it's a combination of genetic, environmental, and neurological factors. It's not something one chooses or can easily shake off. It's a part of the individual's life, and they navigate their world with it every day. We've delved into its diagnosis, highlighting the importance of qualified medical professionals in accurately identifying and treating this disorder. We've underscored that it's not a label to be feared, but a diagnosis that can lead to effective treatment and management. We've examined how it affects daily life, emphasizing the need for compassion and understanding. It's not about dismissing someone's emotions as a mere episode, but about recognizing their struggle and offering support. We've affirmed that bipolar disorder is treatable, that with professional help, individuals can lead fulfilling lives. It's not a life sentence, but a journey where each step towards understanding and management counts. We've reiterated the role of loved ones in this journey, reminding us that their support can be a beacon of hope. It's not just about being there in the good times, but standing strong during the storms as well. Remember, bipolar disorder is a challenge, not a character flaw. With understanding and support, those living with it can thrive.